Step 10, male fertility workup. In this step, we will discuss what investigations you need to have if you have a male factor infertility. So, male infertility is generally caused by three categories of problems. Testicular, which is linked to the problem in the production of the sperm by testes. Pretesticular, that's due to the problem of regulation of male fertility by pituitary gland. And post-testicular, that's linked to the delivery of problem in the delivery of sperm from the testes to ejaculate. So when men undergoing fertility investigation, they have two types of investigations initially. First is detailed history taking, which involves finding out if you have any significant medical problems and if you have any problem with the frequency of intercourse or any problem with ejaculation. So then second test is a semen analysis test. If your history is not significant and if your semen analysis result is normal, then we assume most likely either you have unexplained infertility or infertility is linked to female factor. So if there is any problem in the semen analysis mainly, you start having further investigations. That first includes doing male hormone profile test. In male hormone profile test, you do FSH, LH, testosterone, and prolactin. So the reason for doing FSH and LH test to find out if you have a pre-testicular cause of male infertility. In this category of problem, you have a low FSH and LH. That is usually caused by taking anabolic steroids or testosterone for bodybuilding or any sports enhancement activities. That shuts down your FSH and LH production. So then second cause for that is a severe physical and mental chronic stress. So short-term stress doesn't cause really much problem to your fertility, but if you have a chronic, long-term physical or mental stress, that can reduce your FSH and LH production and that can impact your sperm production. So then prolactin will tell if you have a pituitary adenoma, although it's a very rare condition. And also low FSH and LH may be due to genetic condition called Kalman syndrome. So that's also very rare. So the next is we try and understand if there's a problem in the level of testes. So which means you either have a high FSH and LH or you may have a normal FSH and LH but still sperm quantity, quality, and motility and morphology is low. So that's usually caused by genetic conditions called Klinefelter syndrome or Y chromosome macrodeletion. For that, you need to have a genetic investigations for karyotyping or chromosome investigations and DUS test to rule out Y chromosome macrodeletion. And also this can be caused by cancer treatment, by radiation, chemotherapy, which can cause problem in the testicular tissue, and also childhood trauma, childhood bumpers, and childhood history of undescended testes. So also it can be caused by environmental factors like exposure to environmental chemicals and radiation, and significant lifestyle factors, heavy smoking, heavy drinking, using illicit drugs. So, and then that can be established by taking history. Also in this level, you need to have a testicular examination to check the volume and consistency of the testes. Testicular volume tells if you are running out of stem cells in your testes. If your testicular volume is smaller, that indicates that you may be running out of stem cells in the testes. So also a pelvic ultrasound scan will check the volume of the testes, and also testicular volume is measured by orchidometer, and then you can monitor the volume of the testes over time. So, and the third level is a post-testicular, where pituitary is working very well, testis is producing plenty of sperm, but the sperm is not coming out into the ejaculate. So that means there's obstruction. That's called obstructive male factor infertility. That can be caused by genetic problem called congenital absence of vas deferens. That is a condition caused by cystic fibrosis. For that, you need to do investigation for cystic fibrosis, which involves genetic testing for the condition. And also this can be caused by STIs like chlamydia and gonorrhea, and you need to have a test for STIs. And also it can be caused by retrograde ejaculation. That's usually caused by diabetes or history of prostate surgery. So you need to have screening for diabetes. And also ultrasound scan can show if there is a missing vas difference for congenital absence of vas difference, like we said earlier, which is caused by cystic fibrosis. And all men undergoing fertility investigation should have an investigation for blood-borne viruses: HIV, hepatitis B, hepatitis C, and syphilis. You can see from this chart that there are three categories of problems which can cause male factor infertility, and your investigation should be directed to finding out where you have a problem, and it has to be done systematically so that we can diagnose it accurately, and then treatment can be directed towards that.